Bruised, battered and scared, Jane Taeli says she never thought she'd be a victim at her workplace. Taeli worked for 20 years as a nurse and says she has now forgotten how to even clean a wound after this incident. Taeli says if only the doors of Thusanong District Hospital had proper locks and there were more visible security guards, this incident would have been prevented.
I was working in general ward alone at the back there, and other nurses were in front near the door where this patient came and fighting all the nurses that were there at the door. Now I was at the back, I didn't hear anything. I just saw him coming and attacking me and assaulted me very much with fists, kicking me, doing all those things, and even wanted to rape me.
Taeli says all she hopes for is better working conditions for public health care workers.
Oh, I am negatively affected by this incident because I didn't know that one day it will happen like this, because I have a long time being a nurse and I used to like my patient, so it's so bad.
Some of her colleagues who not only witnessed the ordeal but also tried to defend themselves against the accused say they are still traumatized by what transpired.
Now I go to work, but I'm not okay. I'm only going because I'm a breadwinner. I have only one child in my life. I'm only going to work because I need the job. When I get into the gate of Thusanong, I get scared. I have not been to work. I'm going for an operation because I have internal bleeding, and doctors don't know what caused it. But I think it's when he was busy hitting me with a door.
NEHAWU condemned the incident and blamed the Department of Health for not taking care of its workers.
I strongly feel that the nurses are not actually taken care of, yet there are people who are delivering services, healthcare services to our communities, and also the very members or staff within the workplace. For that member to have been treated like this by a patient that they gave service to, it is not acceptable at all.
Meanwhile, the Free State Department of Health has acknowledged that more should be done.
That is the issue of security. I will be meeting with the HOD and other members of the department in relation to how we're going to manage the issue of security. But it's something that we've been discussing for quite some time. It's just that we didn't have money to appoint security guards, but at least now we have some money to appoint security guards, and some positions have already been advertised.
Molahlehi Takadimane is set to appear in the Odendaalsrus Regional Court on 26 August for a bail application. Abigail Fasahi, SABC News, Odendaalsrus.